simultaneously to ensure that when the 14th General Program of Work meets Gavi's LEAP, they make sense on the ground in Africa, Jakarta, and Rio. And thirdly, last week in Kigali, the Sankore Institute of Global Negotiators was outdoored. We're tired of arriving at procurement tables with nothing but goodwill, only to leave with shackling conditionalities. The Sankore Institute of Global Negotiators will ensure that when we negotiate technology transfer or voluntary licensing, our team is as sophisticated as our counterpart. But even with reform and negotiation, we need a switchover mechanism. The architecture of global health was built in 1948 when most of Africa was still colonized. It was designed with the assumption that financing comes from outside and standards are set elsewhere, and Africa is just the consumer. Today, as the AU champion of African multilateral financial institutions, it is estimated that Africa has over $2 trillion in investable funds. The Afro-Exim Bank has pledged $2 billion for manufacturing. The political will is there, and the funding is there. What is missing are investment-ready pipelines. And so Hinge, the Health Investment National Gateway Enablers, is our response. It is a deal room, not a boardroom. It will focus on maternal health and bioinnovation. And our commitment is simple but aggressive. We will deliver bankable co-finance deals within 2 years. 24 months, not 24 years of communiques, not 24 validation workshops. We've asked the IFC, the AFD, and the Afro-Exim Bank to join us in a post-summit retreat to anchor the first structured deal room before the UN General Assembly is held in September this year. We cannot afford a leisurely pace when 182,000 women in sub-Saharan Africa are going to die this year in childbirth. To those who think the Accra reset is a fleeting performance, we're digging in.
In one jurisdiction could become your biggest problem, even though you are way apart. So there's a need to always think about health, not only within our borders, but globally. That's what he's been pushing for over time, largely because the U.S. has taken a new approach. Donald Trump has decided that it will cut funding that was to USAID. Major health, when it comes to health interventions in Africa, one of the biggest sources was the USAID. Well, like I said, we have a guest in studio this morning, somebody who works at the Greater Accra Regional Hospital. His name is Emmanuel Adipa Adapo. He's a senior medical officer at Greater Accra Regional Hospital. The thing we all call it REACH. Yeah. Yes, so REACH.
Say REACH.
REACH Hospital. How are you?
I'm fine, thank you. How are you?
It's been a while.
Yes.
Long
It
while.
has been a while.
Fine. I'm also fine.
Right.
I'm also fine. How is the Greater Accra Regional Hospital?
Yeah, we are doing well. We are reeling under that unfortunate incident which happened a while ago, but generally we are doing well. Yeah.
When you say you're reeling under, is it reputational or image? What does?
Oh yes, it goes to the image of the hospital and generally what we could have done better for the patient. Ridge Hospital has a policy of usually not turning away patients. So under the circumstances, we basically are overwhelmed every day with patients who will not even go away if you turn them away. But unfortunately, because of not having beds, that incident occurred. So, well, we've been sued, but we are still delivering service.
Okay. Very interesting. And of course, the discussion today is on health. You work within the health sector.
Yes.
Now, when you talk about pressure on you, I realize that this government is trying to do something, the attention of free primary health care, saying the secondary health care, then of course there's the tertiary level.
Yes.
Okay. So you basically, in which bracket do you fall?
Well,
Greater Accra Regional Hospital.
Greater Accra Regional Hospital, we are a tertiary hospital.
Tertiary.
Yes. So we are supposed to be a referral center for problems that the secondary hospitals are unable to solve adequately. So that we bring finality to it and then continue with the rehabilitation and reintegration of the patient into society.
But that's not what happens, I guess.
No, everybody walks in at any time and wants to be seen. And so I believe that this is why the primary healthcare is very good to categorize everybody. You don't just walk into a tertiary facility, even though we have an OPD system. It should be by appointment basis. But walk to your primary healthcare center, walk to your CHIPS compound, walk to your polyclinic, and get that headache sorted out. If they feel the headache is beyond them, they would have given you some first aid, which will hold you together before you move on. But to come with a simple headache, malaria, and all those, tertiary hospitals are not meant for that. Yeah.
So it means you get to see people on a daily basis who are there with malaria.
Yeah. For me now, my specialty is infectious disease. So,
so you are
I get to manage people living with HIV. And I'm supposed to manage their underlying conditions as well. You know, and I keep getting patients who come in daily because of the stigma and because of the way the hospital, the Greater Accra Regional Hospital is structured. We do not, it's a one-stop shop for such people. We do not want stigmatization. So I, as the doctor, have become even a better family to some of them than their own family. You know, some may not want their conditions disclosed to family, loved ones, all that. And I'm bound to keep that. So if I am to be overwhelmed with some other daily walk-ins, that will be very much on us. Yeah.
And I guess, is that where the problem is coming from? Because ideally, not too far from you,
it's at the Braka Polyclinic.
Yeah. But instead of people going there, somebody will just walk straight into it.
Yes.
When they come in, are you able? Okay, so what are you supposed to do?
We don't send them away.
You can't say go.
Yes. So we are forced to open an OPD. For such people. However, under the circumstances, you realize that the doctors are not many, so we will have to, send doctors to them as well, while the rest get to do the ward work. We even admit patients, so we have to review them daily. And sometimes you would have to go see OPD cases before you come and do ward rounds.
I see.
That is a double burden, and basically some polyclinics are left bare.
They are not being used to the extent
that they have to be. So that must be made, very firmly to people. That they are very competent doctors there in the polyclinics. Just assess them. If they feel that, because of course the polyclinics are not equipped to the level of a tertiary hospital now. So, but even the polyclinics also have their district hospitals. So these are secondary facilities, and the district hospitals are secondary facilities, and they are also referral centers. But people bypass all those. Mahama'S General Hospital, for instance, is a district hospital. It can do so myou things. But people will come all the way from Newtown, Mahama'S to Ridge Hospital straight.
Do you understand? So and I guess one of the things that you would have encountered is trying to understand exactly why that happens. Do you understand why somebody would decide that even though I have malaria, I'm not going to Mahama'S?
Well, maybe
I want to be at Reach.
Maybe it's the patient's experience. It may be customer satisfaction. I mean, you know what we did during the COVID management, for instance.
Yes.
I mean, Greater Accra Regional Hospital was the go-to hospital during the whole COVID management and experience. So with with the way we handled the situation, I tell you, even though certain, one or two misunderstandings may happen, Ridge Hospital is still the go-to hospital for many, many patients.
Okay.
And because when they are discharged, by word of mouth, they will go and tell, a friend will tell a friend to tell a friend that, when I came, this is how I was managed. These are the departments they had. These are the doctors who came to review me and all that. Let me tell you, our NICU is, I can say, the best in the country.
Okay.
So if a mother, the neonatal intensive care unit, for instance, so we have all the departments of keeping babies, maintaining them, to the extent that even premature babies, we do well to make them survive at Ridge Hospital. Okay. So if a mother had an experience, a near-death experience with the child, and comes and survives at Ridge Hospital, she will go back and tell her friends that,
everybody should go to Ridge Hospital.
Please go to Ridge Hospital. And especially if he had a one-on-one contact with a doctor who took special care. My phone number is
all over.
I don't have any privacy at all anymore because of calls that I receive all the time from people who would have recommended, somebody. People I don't even know. Somebody can just leave a message and say, do this because I got your number from this person. Okay. And I believe it happens with my colleagues, the various departments as well. So that is why Greater Accra Regional Hospital,
so when you do
even though it's controversial, it's still the go-to hospital in the Greater Accra region.
So the pressure is also largely due to reputation.
Yes.
Very good reputation.
Very good reputation, yes.
You attract a lot of...
Exactly. So, and therefore, we become overwhelmed, and maybe there may be one or two slippages that will get us into the news on the wrong side of, the healthcare delivery. But generally, we are on top of issues.
I can understand. The story you were just telling me remind me of one doctor. I think his name is Dr. Clarence, who was at Ridge Hospital.
Yes, Clarence.
Yes, and he became... the women started recommending him.
Okay.
So nowadays it's difficult to get him. But that's so I wonder what the health ministry, government, or Ghana Health Service, all those involved trying to change that pattern needs to do to be able to make the free primary health care effective. Because now you need to convince people that I like Reach, I believe in Reach, I should leave Reach and go to Mamobi General Hospital or Dansuman Polyclinic, all those things. People move all the way from here to Reach. What do they need to do for you?
It will come, first of all, it will come with education.
Okay.
And once the education is rolled out, then the Ministry of Health, because they are the policy makers.
Okay.
Ghana Health Service staff, we are policy implementers.
Okay.
Now, the implementation of the policy depends on us. Okay. But that, like I said, must be preceded by education. Okay. So, for instance, the free primary health care, the president said it during the World Health Assembly, that actually the national health insurance only covers about 66% of the population.
Okay.
Right?
66%.
66%.
Okay.
That leaves a deficit of 34% who will otherwise come out of pocket.
Okay.
All right. And why are they not hooked onto the national health insurance? It may be because they don't have the money to even register for the the premium.
Yes.
Even though it is the same across the board.
Yes.
Now, so those people, that is why the free primary health care has come, because they also belong to that bracket that contributes to the high burden of non-communicable diseases that would have been detected late, where they would have had a stroke.
Okay.
So now the education is go to your CHIPS compound.
Okay.
And have a screening. When you are screened, we can then detect your condition very early.
Okay.
Right?
Okay.
There are some that are in the stage where we can tell you that change your lifestyle. And once you change your lifestyle, that condition may be prolonged or may not happen to you at all. Right? So if you begin to have your screening, then you will not be in the late stage to be rushed to a secondary or a tertiary hospital, bypassing all those all those areas. So that is why that 38 million Ghana cedis was made available in the 2026 budget for to cover the rest of the the 34% that are not hooked onto the health insurance. So once education comes and people begin very early knowing their health status, it will reduce gradually the burden on the secondary and tertiary hospitals having to deal with emergencies that overwhelm the bed statuses in the hospitals.
So for you, it is an important intervention.
It's a very important intervention. The free primary healthcare is a very important intervention. Everybody should, once you are in your vicinity, go to a CHIPS compound, get screened for a blood pressure. It doesn't take a lot to do. To check blood pressure, and all the equipment I believe have been supplied to the various CHIPS compounds, and I know it's also a continuous process. Those who have not received yet will be receiving, and the new CHIPS compounds that are going to be built according to the number that have to be built by the district assemblies, these equipment are going to be provided for them. There are some basic medications that are also going to be given to them, medications that are over the counter.
Okay.
That can support management of maybe malaria or those ones. They are also going to be stocked there. So once you go and get screened, if it's a communicable disease, you get treated. If it is a non-communicable disease that can be managed by lifestyle, then they will educate you, because the nurses who are going to work there are trained to educate on health promotion. That is the health promotion aspect, which we have neglected for a long time. So if we do the health promotion, then we will be able to prevent the diseases from happening in the first place, and then we would have prevented the referrals and its cascading effects along the way.
Has that for you been the biggest challenge with Ghana's health system? That every Ghanaian thinks that a hospital health center is there to only cure or be part of a curative.
We have also not dealt well with the population as health workers, I'll say, because education on health promotion has been lacking thus far until such a time as this, that the president has made this bold intervention. That because a lot of people believe that the free primary healthcare actually has already been incorporated into the health insurance and all that. But that is not the case. It is not for everybody to walk to any secondary or tertiary hospital for. These are for curative purposes. But the health promotion aspect, which is incorporated into the free primary healthcare, is been lacking. People growing up, you realize that even though it was military era, the community health nurses used to come to our homes. I used to live with my grandmother in Adina, so we had a community health nurse who used to come to our homes and educate us, even teach us how to filter our water, our drinking water, to prevent diseases. Those things are not there anymore, and this is what the president is introducing, because waterborne diseases, there must be somebody to teach people who are living in the remotest part of the country so that they do not contract a disease like bilharzia, for instance. And some communicable diseases can lead to non-communicable diseases in future.
There's a link.
Two examples. Yes. Two examples are bilharzia, which is the river borne disease that causes people to urinate blood. Right? That worm, because it inhabits the eggs, inhabits the bladder. That is why the capillaries in the bladder burst because of their existence over there and cause people to urinate blood. And that's how we are able to diagnose them in the lab. That, if it is not treated or if it is not managed, can result in bladder cancer, which is a non-communicable disease.
Bilharzia can lead to
bladder cancer, I'm telling you.
I see.
Yes. And then another is hepatitis B infection, which is a communicable disease, right? A viral infection that inhabits the liver and gets the liver destroyed. That communicable disease, which is usually sexually transmitted and through other blood products and all that, can lead to liver cancer.
Okay.
In fact, it is the second highest cause of liver cancer apart from tobacco smoking.
I see.
So these things, people must be educated to prevent them so that it does not lead to this that will end you in the secondary or tertiary hospital. So we must do the promotive and the preventive aspect of the free primary healthcare and take it up aggressively.
If we do,
then we will even be reducing the number of those diseases that we see along the way. Secondly, smoking, alcohol, and all that in excess. We need people to be educated on the destructive aspects of that, even though it is recreational and everybody can, do whatever they want. If we are able to get one or two people to be educated on the wrong aspects of these and how dangerous they are, we would have saved a couple, prevented them from even starting in the first place because of their addictive nature. So if we are able to educate them on health promotion and the prevention of those things, then we would have, reduced the burden along the way. And that is why it is very important to take the free primary health care. Now, the other thing is also the education on the Mahama care. So you see, now the health insurance has become a middle chain for the primary health care
and the secondary
and the Mahama cares.
Okay.
Now, so free primary health care, you don't need a health insurance card to go at all.
Okay.
Just go, get screened, and go your way.
Okay.
Whatever advice they have to give you, they will give you from there. You don't need to pay anything.
Okay.
The government has, made budgetary allocation for that.
Okay.
Secondly, if you have to be referred, for instance, your blood pressure is high and all that, then your health insurance kicks in.
Okay.
Where if you are hooked onto the health insurance scheme, your secondary and tertiary healthcare takes care of that.
Yeah.
Now, if it goes beyond the secondary, then you come to the tertiary institution.
Okay.
Where you are referred appropriately, you are hooked up onto the Mahama Care program. And because that one, your doctor or your specialist who is attending to you must hook you up. Okay. And then when you come to that tertiary facility, then Madam Obiadako Opoku would have received your messages and then from your doctor. Because there is going to be a digitalized system where your doctor onboards you onto their system. And then they also review and then they will send in money to take care of your dialysis or your cancer care or your hole in heart and all that.
And I'll come back to the issue of Mahama cares. Still on primary health care. Is it a mindset problem?
Yes, I think so.
Because
I think so.
The same Ghanaian who perhaps would not have gone to a health checkup in Ghana ends up in the UK. And then when they are telling you that they have to go and do their health checkup, that's required.
And they do that every year.
Yes.
So we are also advocating that everybody, even if it's your birthday, for instance, or a holiday, you can choose that. You can choose one day in the year to do a general health check. Okay. And the basic ones have been made available to you at the primary healthcare center, which is your CHIPS compound or up to your polyclinic level, right? So you go there, you have your health check. You have they have been given glucometers to check your blood pressure. Your sugar level to see whether you have diabetes problem or you are on the borderline of or pre-diabetes, right? So that we can quickly put you, and then there will be nutritionists to educate you on your diet. Okay. Now, the experience I had in Korea in a primary healthcare center will blow your mind.
Korea?
I'm telling you.
Okay.
Their primary healthcare center is even bigger than the Greater Accra Regional Hospital.
Primary health?
Yes. Bigger than the Greater Accra Regional Hospital. And I dare say maybe the size will be Adabraka Polyclinic and Greater Accra Regional Hospital combined.
That's huge.
Yes. Look, They have a kitchen in the hospital that will teach you how to cook your food. The nutritionist, the dietitian, these are all part of primary health care.
Okay.
For you, if they notice that you have a diabetic condition or you hypertension, there are certain things you should not eat. Fatty diet, your fruits and vegetables should be more, and all that, in the proportions in which you have to prepare them to eat. Look, they have a consultation for you, and you come to the hospital maybe on a Saturday, and then they would have booked a lot of people to come that they will put on various diets, and then you all go to the kitchen. After the consultation, you go to the kitchen. It's like a theory and a practical session.
Okay.
People who have to be rehabilitated, strokes, if you see the way their physiotherapy center is packed for people to just come and exercise,
okay,
as part of their primary health care program.
Okay.
Beautiful. So, but that we have to also start from somewhere, and that is why the CHIPS compounds will serve that purpose.
Okay.
And then you remember the Ghana Medical Association also has launched the exercise, the health promotion aspect recently in Legon, where just members of the medical association went and had some exercises in Legon, brisk walking and all that, to ginger people to do so.
Okay.
Because it's very important. Sedentary lifestyle is one of the major risk factors for obesity, for cardiovascular diseases, for other non-communicable diseases as we go along.
I see. Now, I'll conclude on the matter of free primary healthcare by asking the question, because you talked about the Korean example.
Yes.
Now, most of the times our governments launch policies, and then they leave it to those of you who are implementing to do so. And they don't provide the necessary equipment.
Yeah.
You don't see the facilities changing in any way.
Exactly.
They expect you to do the same thing under a new regime. What do you think should be the commitment of government to ensuring that this policy actually succeeds? What needs to change on the part of the policymaker?
I believe that those who are not well versed in health should agree that they may be in policy making positions, but they are not well versed in the policy implementation aspect, and therefore they should allow those in the practice to lead the implementation of such.
Okay.
Now, for instance, equipment, the sort of equipment that have to be bought, the technical people's buy-in must be sought.
Okay.
Because there are stethoscopes that are digital stethoscopes these days.
Okay.
Right? And they listen and hear the slightest murmur of the heart, or the slightest, heartbeat that is not aligned, that is not correct.
Okay. Stethoscopes.
Stethoscopes, yes. They can do that. And so you cannot just go and buy a stethoscope that, just only listens to the lapped-up sound of the heart and put it, somewhere in the hospital, or you do not expect the worker, him or herself, to bring his or her own stethoscope. These things must be part of the retooling process.
Okay.
So that the worker does not become handicapped in the service delivery. That is something that breaks the heart of the people. And you see, that is why recently I am glad the Minister of Health engaged the Ghana Medical Association regarding the posting of doctors.
Okay.
Because you go to some of the villages. I was on a trip recently to monitor malaria. And I must tell you that CHAG hospitals are doing far better than government hospitals on the same level.
Okay.
So a CHAG hospital that is a district hospital status has better equipment in the lab, has office space for the lab staff, and a whole government hospital will only have a space like Radio Gold, and all the machines are displayed in one view. The lab manager doesn't have an office to stay, especially in a district hospital, and it is disheartening to see.
Okay.
So every facility that is built, the buy-in of doctors, lab people, nurses, and everybody should be brought on board, right? Politically, for instance, the Minister of Health is not a health person, but he is doing very well by listening. So the infrastructure that has already been built and these facilities are not there, going forward, people who are going to use the facilities should be sought, should be asked, so that in the architectural drawings, these things will be put in place. So that when they go, he sees that, I trained in the Greater Accra Regional Hospital during my rotation period, but I can survive in Donkokrom, where I did my obs and gynae rotation, or I can survive in Nalerigu, or I can survive in Saboba, or I can survive anywhere. And it will not seem as though I am being punished by being sent to a place that I am going to lose my skill in the end. These are the things we should take note of. And like I said, we can copy from models that are out there, especially when we have the ability to fly out of the country. We see how emergencies run. It shouldn't have taken us the death of a specialist in Konfanochi Teaching Hospital, a specialist emergency physician, for us to wake up to the call that, we need cath labs in all the tertiary hospitals. How can we be practicing cardiology without a cath lab? Where, when there is a blockage in the heart vessel, quickly they put in a guide wire, go into the vessel that is blocked and remove the clot. And then the heart begins to beat again. All these things, sometimes it is not salary. We do not go on strike just on salary or other conditions of service, but the equipment to work. When people, train, and over the years, can you imagine the existence of Konfanochi? Can you imagine the existence of Kolebu? And Kolebu does not have a cath lab. Konfanochi does not have a cath lab. The only cath lab we have in the country in a government hospital is UGMC, which was built recently. Right? So politically, we should have a blueprint of how our health facilities from primary healthcare centers to tertiary hospitals should go. And that will cause people to even want to stay in the country and work, because medicine is the application of your skill. You get better as you age. But if people see, recently one of my classmates left the system, a very huge person, an anesthesiologist. He's left. He's gone to Canada. And we have lost that person because he teaches. He trains, nurse anesthetists. He trains doctor anesthesiologists. He trains, other colleagues who are under him. A consultant. He is gone. Because certain requests over the years stay on the table. And I'm glad at the president's 3 requests that he made to the World Health Assembly. He said we should invest in execution.
Invest in execution?
Yes. Such that things that are planned do not go and stay on the desk of a public health officer in a remote village without execution. When you invest in execution, you police it, you follow the implementation process. You make sure that the things that are required to be placed there are there, so that you do not get taken by surprise when you make a surprise visit and you see that people are not adequately being managed, and the patients get angry with the health service providers, because in the first place it is not their duty to provide those things, right? There are some things that when people get to do them out of their will, they will be charged with causing financial loss to the state without recourse to certain audits. You see what is happening to the people and the Public Accounts Committee.
Yes.
So they are also restricted in certain things that they can procure.
Okay.
But if the government procures for them through their buy-in and what they are capable of using to work, then it will be used to train. Now, money that is generated internally can be set aside for the repair of those equipment.
Okay.
So that the primary health care doesn't suffer. Because if you buy equipment and you don't empower the people to repair them, and they will have to face consequences for repairing them and using money to invest in them, then there's going to be a problem and it is going to stall. But people must be encouraged to repair their equipment. The right equipment should be given to them in the first place to use. They should be taught how to calibrate those machines so that the measurements they are taking will be the right measurements.
Okay.
And the replacement of consumables should be adequate and should be timely.
Okay.
We shouldn't look. I'm very glad at the knowledge the president brought in when he was discussing this at the World Health Assembly. He gave his problem statement. He gave his, even though he knows that there is a problem, because Africa contributes just 1% to our vaccine production. Do you know that? 1%. But
I'm maybe surprised you do 1%.
1%. But we contribute 25% of the global health burden. Do you think the world will take us seriously when we come to the table? And that is why he says, I am taking these bold decisions to make sure that even though we have lost 40% of the World Health contribution by the United States withdrawal, and out of that 40%, we in Ghana have lost $78 million that would have come as aid to us.
Okay.
We are not going to relent because we no longer have to be the subject of World Health policy. We must be the author of the policy.
Okay.
We must take our own health into our own hands and go forward with the management of our healthcare. Yeah, because the health of the country is the wealth of the country.
Because he said three things that he said.
Yes.
You mentioned the investment in execution.
Yes.
What was it?
And he says that we must follow through with our plans. Whatever we plan from here, we must follow through.
Okay.
And the third is that yes, we must follow through with execution. And the third is that we must let me refer to it quickly.
Okay.
I think.
Okay. If you just join us, we are speaking to Emmanuel Adipadapo, Senior Medical Officer at the Greater Accra Regional Hospital. In fact, the president has been leading this agenda.
Yes, and he says the third one is that let us measure success by the clinic and not the conference.
Success by the clinic.
Yes, and not the conference. And this is a master stroke presentation that he made. Let us measure the success by the patient who comes to the clinic and gets good customer care.
Okay.
He gets tested adequately. He gets diagnosed. And he gets his treatment.
These words are weighty words.
Very weighty words. We shouldn't just come to the conference and say, oh, we reduce maternal mortality by 1%. How are we supporting it?
Okay.
Let me tell you, if we are able to put in the structures of early detection to management, we will be able to beat maternal mortality even by more than 90% in a year.
Measure success
by the clinic and not by the conference.
That's an interesting thing he said.
Yes.
So which means ultimately it's what happens at the clinic.
What happens at the clinic. So the policy making must translate into the policy implementation, and it must be tangible. It must be obvious.
Okay.
It must be measurable.
So you should be able to walk into the clinic and say that we are being
well taken care of. So that even anybody, people who travel from Accra to funerals and all that, the adequacy, the ambience of a CHIPS compound should be able to let them get in and get their pressures checked.
Okay.
Look, if you don't have anything in the CHIPS compound, the nurse comes to sit there, he doesn't have medications, he doesn't have anything. Do you think somebody, And look, there's no longer a village anywhere.
No.
No. Do you think people would like to go and sit on a stool or
okay?
But now everybody is paying a flat premium, whether they receive 100,000 or 10,000 a month.
We all pay the same.
We all pay the same premium, which is a burden on the national health insurance. But that I leave that to the policymakers to deal with. Therefore, can you imagine paying 40 Ghana cedis, let's say, as premium, and going to the dialysis center that charges about 350 Ghana cedis per session, and you must do 3 times a week?
350 per session.
Yes.
You have to do 3 times a week.
3 times a week.
Okay. Your 40 Ghana cedis doesn't even come close.
Doesn't even come close. So, are we paying realistic tariffs into the National Health Insurance Kitty? No, we are not. So, to augment, so the National Health Insurance scheme has a limit.
How far it can go.
It has how far it can go. It has how many medications it can purchase.
Yeah.
It has the categories of medications that it can even purchase. Now, our childhood cancer burden is increasing, right? If you come to the Greater Accra Regional Hospital, you will see that the childhood cancer burden is increasing. Kolebu and all the other referral centers that have cancer, So childhood cancer centers now must also be established, and this must be a part of the Mahama Cares program.
Okay.
Establishing such centers, equipping them to handle the cases, and then providing health financing for such. Secondly, hole in heart. Children are born with hole in heart. These are not expectations from families or their parents, but it so happens. And some of these, hole in heart cases are so, complex that they will need surgery for the child to survive.
Okay.
So, you pay 40 Ghana cedis. And even the equipment that are bought and placed in the cardio center for the open heart surgery. Can you imagine the cost of the equipment?
Yeah.
Health insurance will collapse if it has to, foot those bills. Okay. These are things, in Ghana, because many of our diseases deal with communicable or infectious diseases. We are now even getting to realize the burden of the non-communicable diseases. Yes. So as for the cancers and, certain congenital diseases that occur in families, in children, if it doesn't happen to you, you may not know. So you can get away with whatever you want to say. This thing cannot, for money for a hole in heart child, cannot be put onto the health insurance. Okay. Especially when it is not even on a sliding scale as we speak.
Okay.
Thirdly, like I said, we have rolled out, this HPV vaccines for girls who are likely to have, the human papilloma virus infection that will invariably lead to cervical cancer. Now, such cases, when that happens and a surgery has to be done, for the whole womb, for instance, to be removed and all that, these are not cases that, and for chemotherapy afterwards, these are not cases that the health insurance can handle. Okay. And therefore, there must be an alternative source of funding, which is sustainable. Okay. And as and when those cases come, we weigh the merits. We look at the stage that the infection, the disease is. We look at the survival potential, so that money is released into the care of the patient. And then another important aspect of the Mahama Care program is the establishment of infrastructure.
Yes.
The 6 cath labs that are being built.
Yeah, being built.
It's from Mahama Care. Now, those 6 cath labs are supposed to be a training center for people who want to specialize in cardiology. And then that means nurses who want to specialize in cardiology are going to get to be trained. Doctors who are specialists in cardiology but have never worked with a cath lab before get to do refresher courses, get to try a hand at it, get to see a professor do it, and then they will also learn to handle it.
Okay.
Thirdly, the Mahama Care is also there to train specialists.
Okay.
So now the Ghana Medical, the Ghana College of Physicians and Surgeons have already, been spoken to get ready to train people for to manage, to become specialists, to manage cases like that. Now, the Ghana Nurses and Midwife Council have also been spoken to. The College of Nursing and Midwifery have also been spoken to. I believe the next will be the one thing that I think have been forgotten along the line are the schools of anesthesia.
Okay. Schools of anesthesia.
Yes.
Okay.
The schools of anesthesia should not be forgotten.
Okay.
And then the laboratory.
Okay.
Their specialties should also not be forgotten, so that they will also be trained to specialize in certain diagnostic aspects. Schools of anesthesia, for instance, these are people who basically kill you on the table and resurrect you, and then they monitor you after the surgeries are done.
Okay.
Right.
So they are a very important.
They are a very important aspect of the chain that should not be forgotten. And all these trainings are going to be done. So human resource, equipping, right, and provision of treatment, medications, which are 3 pillars of health system strengthening according to the WHO, have all been placed under Mahama Care.
Okay.
And if you are not a health person, you may be talking, but you will not be making sense, unfortunately.
Okay.
And you see the way I have explained it to you and what it is purported to do, people will talk, but unfortunately, they may not. They may use the propaganda to reach a large proportion of the nation that this should have been put into the national health insurance. But if that is not the direction, the policy direction, then we will not be doing a lot of good, and the impact may not be felt at the end of the day. This president, he is the executive president. He also wants to leave a legacy, and he intends that legacy must be obvious for everybody to see. So yes, people who have hole in heart problems are going to be sorted out. People who have some cancers and have a chance at survival are going to be sorted out, and equipping hospitals is on the agenda, and then the training of human resource for health is also on the banner. So that is the legacy the president wants to leave. And I believe that in the next couple of years, when the cath labs begin to show up, when training starts, when people begin to give testimonies of how the Mahama Care has sorted them out and they would otherwise have died, we will begin to realize that the dust settles and the roosters, the chickens come home to roost.
Well, I think we are past our time now. Just to say a big thank you to you for joining us in studio. I wish I could continue because you were just talking about infectious. You do infectious diseases now.
Yeah. So,
yes. So we'll find time.
Yes. Let's
continue this conversation on many of the things that we should be looking forward to.
Sure.
Yeah, because that's such an interesting explanation of the Mahama Cares matter. And the fact that you're talking about the Mahama Cares or the Ghana Medical Trust Fund, and then the National Health Insurance Scheme.
Yes.
How a National Health Insurance Scheme is set up.
Yes.
What it is capable of doing.
Exactly.
And what the Trust Fund will come into.
To complement what the National Health Insurance is doing.
Let me conclude by asking you about the communicable disease burden.
Yes.
No, actually the non-communicable disease.
Yes, it's about 45% of total mortality.
Well, I heard you talking about child cancers.
Yes, childhood cancers are also increasing. leukemia is increasing. There are certain forms of cancers that, we find in children, and certain forms of anemia that are inexplicable. And unless you do the test, you may never discover. So these are very important aspects of the Mahama care that we have to look at, so that, because most childhood cancers, if they are detected early, they are curable and the children live.
Okay.
Yeah. So
if they are detected early.
Yes. Yes.
And all this will be, because it looks like until this idea of the trust fund came in, taking care of people with this kind of diseases, it's donor dependent,
very, very expensive. Very, very expensive. So and the national health insurance is limited. It has been limited all this while to these. And doctors have to,
find a way.
So it means donor funding
in
to
many
be able
cases,
to take care of the children.
You have people who come in with non-communicable diseases.
Yeah.
They need to be managed.
Yeah.
They can't pay for it.
They can't pay for it.
You can't get national health insurance to pay for it. In those circumstances, what do you do as a health professional?
So as limited as you are, you just treat as much as you can, and then speak to the relatives, maybe to take home. So it is now that we are building some wellness centers. We are building palliative care for such people, so that we keep in touch with them, assign nurses who will tune the people's minds to know that the end is here. But Mahama Care, I believe, is here to at least extend some hope and extend life.
Thank you. Thank you for joining us. Dr. Emmanuel, throughout this whole conversation, this is the first time I'm calling him doctor. Dr. Emmanuel Adapo is a senior medical officer at the Greater Accra Regional Hospital, popularly known as the Ridge Hospital. So one of these days when you go there, you might run into him. Yes, that's where he earns his daily bread. Well, we are done for today. And thank you very much for making time to join us on the show today. If you're live on Facebook, thank you. And if you listen to us via radio, thank you. We will see you tomorrow with another edition of the Gold Morning Conversation. But before we go, this one was sent to me earlier by a very dedicated listener to this show, Mr. Tete in Tema. Wow. Mr. Tete in Tema says, today is the birthday for my boy, Aaron Tete Nuete. Oh. Aaron, or Aaron, depending on Tete Nuete. We pray for the Lord's protection. So a happy birthday to you. And then this is Kofi Ayawi says, my heart condition is monitored through my pacemaker. It says I have a tabletop here monitor in my house with a digital connection to the Royal London Hospital. That monitors my heart condition. Whenever they detect a problem, they immediately makes appointment for me to come to the hospital for a checkup. Godwin Delasi, who is in Germany, says the health systems in Ghana they're doing quite well, but a lot more needs to be done. We must focus on promotion and prevention and not only curative treatment. Exactly. We need a national dialogue on boosting our health service delivery. Well, like I said, these conversations will continue in line with what we are trying to do now. Because most of the times we just get engaged in this banter and we never make any progress, which is not good for our health system now. And thank you, Doc, once again.
You're welcome.
We'll see you tomorrow.
Sure.
Obo, me who ye? What's for Rudiaso?
And then Maria Yabo. Doctor Simenya hepatitis B.
And you know what? Oh, Hinay, Dr. Cosia, what power specialist have a hospital? Hey, yet dear was Sanya Bini. What hepatitis? I hear someone word on Kwang Kron. Nancy be for Quakency. One of the hepatitis award. What ya to be America? The UK Bruchimem. Nakas or Janoqua. Sir, na fatally van will fry a donchon. Ebeko, prostate, second part to coma boss and all set it, say war, Sekoto, Genoa, Gosokosokra. Fako Power Specialist Herbal Hospital. Oh, we're drunk, sir, and you went qua. Oh, say, you don't want to be.
Oba,